Hello, welcome. In this presentation, we are going to discuss the benefits of exercise in pregnancy. Firstly, a little about me. I am a This Mum Moves ambassador, which simply means I have completed training with the Active Pregnancy Foundation to become an advocate for physical activity in pregnancy. I am a sports remedial massage therapist and have had my own clinic for over a decade. In this role, I am a huge promoter of physical exercise for aiding in rehabilitating injuries, but also preventing injury. I'm also a fully qualified pregnancy and postnatal personal trainer. So let's move on to discuss exercising in pregnancy and why we should be aiming to keep as active as our pregnancy allows and what the current recommendations are. The Chief Medical Officers recommend up to 150 minutes of moderate intensity exercise per week, inclusive of 2 strength training sessions. However, it is reported that the percentage of pregnant women meeting this recommendation is very low. Many women stop, reduce, or don't start exercising during pregnancy due to perceived risks. This is a sad statistic which I am hoping to challenge to help more women feel confident that they are doing the right thing for their baby and themselves. Studies are showing multiple benefits for mother and baby for exercise in pregnancy and minimal negatives. Some of the reasons for stopping exercise during pregnancy can be multi-factor, including fear of harming the baby, physiological and psychosocial, as well as fear of judgment when exercising with a visible bump. There are studies coming through now that challenges these misconceptions, which hopefully will bring confidence to women who want to continue exercise, why they should, and all the benefits continuing exercise will bring with it. However, there are reasons why exercise may need to stop or reduce, and seeking out advice from a professional if any of these affect you is needed. As much as I want to encourage as many of you as possible to continue exercising throughout pregnancy, we need to ensure understanding of symptoms to look out for to ensure safety for you and your baby. On the right hand side of the slide here, you will see I have added a list of some of these warning signs to look out for. If any of these apply to you whilst you're exercising or at any point during your pregnancy, please speak to your midwife, or if you have any other concerns, please speak to them as soon as possible. Most healthy pregnant women don't need to stop exercising, but modifications will be needed as they progress through the trimesters. Promoting the benefits of exercise during pregnancy needs to be improved, including education around reasons why exercise may need to be limited, but in most cases, some level of exercise still has great benefits. The main benefits of exercising in pregnancy are reduced blood pressure, reduced risk of preeclampsia, reduced risk of gestational diabetes, improved mood, improved sleep, which in turn can help reduce feelings of fatigue during pregnancy. It also helps improve your chances of having a vaginal delivery, which can be beneficial for mother and baby. Exercise also improves long-term health in general when we look beyond pregnancy. Studies on pregnant women have shown that exercising in pregnancy can reduce blood pressure by promoting blood flow and reducing oxidative stress. Physical activity boosts the body's natural antioxidants, counteracting harmful oxidative substances that damage blood vessels and contribute to hypertension. Exercise stimulates new blood vessel growth and ensures adequate blood flow back to the heart, preventing drops in pressure, lowering oxidative stress and reducing inflammatory markers. Exercise protects against endothelial dysfunction seen in hypertension disorders like preeclampsia. There are lots of activities for all levels of fitness that will make a difference for the duration of your pregnancy. If you were active pre-pregnancy, keep going. If you weren't active pre-pregnancy, start gradually and build up. Recent studies from Dr. Margie Davenport are looking at the benefits to mother and baby of exercising during pregnancy, and the results are very positive, including improved recovery after birth. Aerobic exercise such as a brisk walk, running, cycling and swimming all help to improve cardiovascular fitness, strengthening the heart and reducing blood pressure. If you were a runner before pregnancy, in most cases you are okay to continue for as long as it feels good to you. Running boosts mood and builds strength and endurance, the perfect preparation for labour. It can also help maintain a healthy weight in pregnancy, which is associated with a healthy fetal birth weight and improves placental blood flow, benefiting oxygen delivery to the baby. If running isn't your thing, a brisk walk is not to be underestimated. This will still increase your heart rate and get that blood pumping and will bring similar benefits as running would. Being fit for labour is another reason to maintain a good level of fitness where possible. Labour takes a lot of energy and requires stamina. Cardio and strength training can give you the fitness needed. Stretching plays an important role in improving antioxidant levels, which assist in maintaining good blood pressure. In addition to this, stretching is a great way to maintain a good range of movement, and even in pregnancies where moderate intensity exercise is contraindicated, stretching can still be part of your weekly routine and offers many benefits to mother and baby. Core work is a good one to focus on for the duration of your pregnancy. It will aid in supporting the muscles supporting the growing bump, reduces back pain, pelvic pain, and improves posture. Being active helps to release endorphins, the feel-good hormone. These endorphins cross over to your baby through the placenta, helping them feel good too. The Canadian Society for Exercise Physiology have developed a consultation form for prenatal physical activity, which you can use to establish if there is any reason you can't exercise at the recommended moderate level. The form includes a list of contraindications. If anything within that form applies to your pregnancy, you can discuss with your health professional who will understand your specific circumstances and can assist in guiding you through an exercise level that is best suited to you. You can use this form with them as a conversation starter. I've pasted the link into the slide here so you can access it directly. Whatever level of exercise you choose to do throughout your pregnancy, it is important to listen to your body and ensure you keep within your own comfort levels. If it doesn't feel good, don't do it. Exercise in each trimester changes as you progress through your pregnancy. In the first trimester, 1 to 12 weeks, you can continue with exercise in almost the same way as before. However, fatigue and nausea due to a significant hormonal shift may curtail the level you can or want to train at. However, maintaining some level of activity can help to reduce some of these symptoms. Even getting out for a walk and stretch workouts can help. From 12 weeks onwards, lying flat on your back is not recommended. Weighted sit-ups need to be avoided, and abdominal or trunk rotations need to be limited. In the second trimester, 13 to 28 weeks, feelings of nausea will hopefully subside and fatigue levels will reduce, meaning you will feel more inspired to move and get active again. Exercise consistency and intensity can be increased in this trimester if it feels good for you. We aren't aiming for PBs in pregnancy, just maintaining strength and fitness. The third trimester, 29 to 40 weeks, when the bump is getting quite prominent and postural changes are at their peak, exercise will need adapting accordingly. Strength training can be continued, and this can help support those muscles to cope with the postural changes. There are so many things you can still do that suit your pregnancy, so seeking out a trained professional in this field to give you the support and reassurance you need is well worth it. But most importantly, listen to your body. Only you know how it feels, and a professional can help support you and provide advice as required throughout your journey. Swimming is great throughout and in later stages of pregnancy. This can be ideal to take some of the weight off tired joints and give some relief from a heavy bump. In addition to specific workout sessions, dance is also a great form of exercise, as is gardening. PT-led workouts are great, particularly if you enjoy working out as part of a class or would rather have support from a professional on a one-to-one basis. My work with the pregnant and postnatal population relies heavily on evidence-based facts. I follow credible organisations and medical professionals who are all challenging the age-old myth that you shouldn't do anything too strenuous in pregnancy. If you were to train with me, you can rest assured that my advice is evidence-based but is not intended to replace advice from your health professional who understands your personal circumstances best. So to conclude, exercise during pregnancy leads to being fitter and stronger for labour, increases chances of a vaginal delivery and greatly aids in postpartum recovery. Motherhood is one long endurance race, and if we can help prepare for it like we would any other event, then we should, especially when we factor in the many benefits to your baby before and after birth. Growing research is providing evidence of the multitude of health benefits for mother and baby, not only during pregnancy but beyond, and not just for mum but for your child too. by maintaining a consistent exercise routine made up with whichever form of exercise is best suited to you really is worth the effort, and you can rest assured knowing that you are doing the right thing. All the benefits outlined in my presentation are benefits to us all in all stages of life, but when you are growing a new human, the benefits become magnified. And if exercising and maintaining fitness can make pregnancy a little easier and more enjoyable, as well as set you up well for labour, then it is a real win-win. I hope this presentation has provided you with a deeper understanding of what you can and can't do when it comes to exercise in your pregnancy, and has inspired you to keep going if that's what feels good for you. You are doing the best you can for you and your baby. Thank you for listening.